Welcome again to Dr. Magaka Show, Dr. Pam Obari Magaka Show. And today we are talking about urinary tract infections, which is commonly known as UTI. And we are looking at ways of treating UTI sometimes if you are not close to the doctor, or how can you prevent UTIs. UTIs are usually caused by bacteria going to your urethra. Going through your urethra. Sometimes it goes to your bladder, and usually there are reasons why it goes up there. Mostly you have to understand the signs and symptoms. Or the signs of urinary tract infection. Usually you want to urinate, or you want to pee, or you want to void a lot. Like you go void in the bathroom, and then after you finish voiding, you feel like you want to go again. You feel like, I didn't finish going, so I have to go again. Or sometimes you feel the urgency of wanting to void all the time. Don't mix the urgency of wanting to void because you have diabetes. If you have diabetes, that is another thing altogether. But for UTI, you feel like you want to void all the time. The other thing is having that burning sensation. You feel like something is not right. Something is not right. When you're urinating, you have that burning sensation. People who have had UTIs before, they can actually tell if they feel like they're having UTI. Usually, common signs and symptoms include female. The reason why female or women, we are more susceptible to UTIs is because our urethra is in close proximity. Our vagina is in close proximity with our urethra up there. So when you're having sexual intercourse, those germs can propel themselves to the urethra and up to your bladder and cause bladder infection. So it is very important to be careful, especially if you're having sex or you're with your partner. Make sure you void or urinate after any sexual intercourse or any sexual activities. The other thing is, which is basic, is cleaning yourself from forward to back. So when you are going to the bathroom, you're going to you're going to poop, or you're going to have a bowel movement, clean yourself from front to the back. If you have patients, front to the back. If you have a child, clean them front to the back, especially a little girl, clean them front to the back. That one, you can avoid complication of diabetes. The complication of urinary tract infection. Some of the people are susceptible are people who have diabetes. They are susceptible. People who are immunocompromised, people who have HIV, who have any kind of chronic disease and they're immunocompromised, they are usually at risk of developing UTI. The other reason, the other people are at risk is people who have had a history of UTI before, people who have had histories of kidney diseases. Most of them are susceptible to having a UTI infection. Also, it is important for you to know that if you are at risk, if you are at risk, you need to drink a lot of water. You need to drink a lot of cranberry juice. If you develop a UTI, you are supposed to ask your doctor. And even the information I'm giving you today is information. I'm informing you. I am not treating you. This is not a treatment session. This is information session. So that if you feel, or in the future you feel like you're having those symptoms, you can always consult with your doctor to see if you're having a UTI, because you can have other things that are mimicking UTI. I'm just giving you information. So if you have that, you can call your doctor, or you can go to your doctor. They will either prescribe you antibiotics. We have different antibiotics. Example is Spectrum that we give patients. You can take it for 3 days, or the amount of days your doctor tells you. As I said, continue drinking cranberry juice. As I said, wipe from front to back. Drink lots and lots of water. After sex, void. Go to the bathroom and void. So those are the things you have to do. If your doctor treats you for UTI, gives you antibiotic, and it takes between 48 and 72 hours, and that is not subsiding, then you should call your doctor and see if there's anything else. Or sometimes it can affect your kidneys, and your kidneys can get infected. So if it doesn't go away and you still have that back pain, or you're having that uncomfort, you're very uncomfortable, you can call your doctor between 48 and 72 hours. Call your doctor and see if the antibiotic they gave you is not working. It is very important to do that, to ask your doctor for advice, always. So it was just a small sharing. If you sorry, if you like it, share, subscribe to my YouTube channel. Thank you. UTI, keep drinking your water, keep drinking cranberry juice, keep wiping back, front to back, and keep sharing my small healthy nuggets for you today. Your very own Dr. Pam Obari Mogaka. I love you, appreciate you. Thank you. Share and subscribe to my YouTube channel. Thank you so much. Be blessed.